you very much, Ceann Comhairle. When I spoke in the Dáil on the 1st of June last about the motion to set up this all-party committee, I said that I regarded this as one of the key health initiatives of the new Oireachtas, and 4 months on, I am even more convinced on the need for a long-term consensus on the direction of health policy. We can make, and indeed I'd contend we are making, improvements to our health system, but the task that faces us is one that requires substantial and sustainable efforts underpinned by a long-term common purpose. At the outset, I would like to acknowledge the work being carried out by the committee, and it's so encouraging to hear the positive update, and in particular the leadership role taken on by Deputy Roisin Shortall, both in the establishment of the committee and now as its chair. I genuinely am excited about this project. I think we're on the verge of potentially achieving something really lasting in terms of our health service. And much work is already underway, as set out by Deputy Shortall and as set out in the interim report. And I understand and am pleased to hear that there has been a large response to the committee's call for submissions. I've had an opportunity to read a number of these that have been sent to me directly, and indeed to meet with a number of groups that made submissions. And I think the volume of submissions does say something about the huge level of interest in this fundamental societal issue. The committee has clearly set itself a very ambitious work programme, and this includes work packages on the funding model, on integrated care, on resource allocation, access to care, to primary care, chronic disease management, organisational reform and workforce planning, amongst others. I appreciate the breadth of this agenda, and I don't think anyone in this House underestimates the challenging agenda that the committee has taken on. I would like to reiterate my pledge to continue to support and assist the work of the committee in any way that I can. The central objective of the new government, as reflected in the programme for a partnership government, is to use the strengthening economy to make life better for the Irish people. For me, as Minister for Health, that means improving the public services that people depend on and that really matter to families and communities across this country. We all know that the health service faces many challenges. Moreover, the programme acknowledges that we now have an ageing population who are thankfully living longer and whose needs will, though, become greater and more diverse. We also, as well as the ageing population, have the highest birth rate in Europe. Most immediately, we have problems for patients trying to access services, whether from emergency departments or from waiting lists, severe pressures on very dedicated staff, and increasing demand and pressure on resources. As citizens, all of us at some point in our lives will need to access health services. Therefore, we all have a common interest in finding a common way forward for improving and developing our health services. During debates of this nature, it is important to acknowledge that the health service has been changing, and it would only be right to acknowledge where improvements have happened. For example, we have seen life expectancy in Ireland increase by 2.5 years since 2004 to a place where it is now above the EU average. We have seen a decrease in the average length of stay in our hospitals, and we've seen significant progress in reducing tobacco consumption. Progress has been made in many health areas, and it's important to recognise that progress, along with recognising those who work so hard at the front line. I've spent the summer visiting hospitals and indeed other local healthcare facilities around the country, and I was struck again by the many positive things that are happening and rarely get seen. The TV programme Keeping Ireland Alive has gone some way to shine a light on the real story of health services in Ireland, a remarkable combination of skill, professionalism and care, often in extraordinarily difficult circumstances. But, Ceann Comhairle, there are long-standing challenges that need to be addressed, and Deputy Shortall has outlined some of them, health inequalities and the geographic lottery being two of them. The government is clear on its objective. I think the Oireachtas is now clear on its objective. We're committed to a goal of universal healthcare, and we're committed to working with others in the Oireachtas, in particular the Committee on the Future of Healthcare, to achieve the single-tier health service that best suits Ireland. And the phrase best suits Ireland is, I believe, the key. We need to take account of the Irish context. We've seen in the past the idea of lifting a model from one country. We don't need to do that. We need to do what is best for Ireland, what model works best. While we can absolutely look at how others do things, we cannot simply transplant something that works somewhere else to here. Nor does a health system in any country operate in isolation from the rest of society. Housing, education and employment are major parts of the universal healthcare equation. Therefore, this requires a whole-of-government health in all policies approach, and this is echoed in the Healthy Ireland framework. This committee has been established to allow us to seek consensus on an overarching vision and fundamental principles for our health system. I believe there are three significant areas that need to be examined in this regard, all of which have been identified by the committee in its work programme. These are 1. The model of care, 2. Universal health coverage, and 3. The funding model. Before we consider the financial implications of healthcare or how we manage healthcare, we should first consider what kind of care we should provide. what is the best model of care for the future? We can and should all support the need for a decisive shift within the health service towards primary care and the effective delivery of primary care in every community. The more intervention we can have for patients at the earliest possible stage and as close to home as possible, the more likely there will be for a better outcome for patients. To do this, it will be necessary to build up GP capacity to respond to patients' needs and to expand chronic disease management in general practice. GPs want to do more and are able to do more, but they need to be empowered to do so, and that has to be the purpose of a GP contract negotiation to begin this year. We need to continue to embed social care and mental health and disability services within the community where appropriate and support people to live as independently as possible. And if the committee don't mind me giving my own view on this, and I think it's something that I've heard the chairperson echo, there is this disconnect between the acute and the community, and it's causing a problem. And if you look at the delayed discharges, we see a focus on our acute hospitals. What are we doing about pressures in the acute hospital? Where often the solution lies in the community, but the person in the acute hospital doesn't have the levers to release the solution in the community. That lack of integration is causing a real problem and is adding to our delayed discharges in a very real sense. The campaign of prevention and health promotion also needs to be continued and stepped up. I don't wish to just be the Minister for Ill, I am the Minister for Health. We all acknowledge that better integration across our health service is key to achieving a better patient experience, improving health outcomes and unlocking efficiencies within the system. In developing models of person-centred, coordinated care, we can draw on the work of the national clinical programmes, in particular the piloted integrated care programmes. Through the work of the committee, I hope we will be able to clearly articulate our desired model of care, the implications of moving towards it and how it can be achieved. I agree we don't need a report to sit on a shelf. We need a model that we can get on with actually implementing. The second area I've referred to relates to universal healthcare. As an overall goal to improve our health services, universal healthcare involves four main objectives as set out by the World Health Organization, namely reducing unmet health needs, reducing inequalities in access to health goods and services, improving service quality and improving financial protection, which means patients must not face catastrophic or impoverishing levels of spending as a result of seeking healthcare. The WHO notes that no country fully achieves all of the universal coverage objectives for 100% of the population, 100% of the services available and 100% of the cost without waiting lists. However, it believes that every country can improve efficiency, reduce waste and increase value from its health spend. This is especially true in Ireland, where we know there are many challenges across the health system. The Government is committed to a health service where all people can access the health service they need in an integrated and timely way, of sufficient quality to be effective, while ensuring that the use of these services does not expose them to personal financial hardship. Among the key building blocks for universal healthcare that are currently being advanced are the following important initiatives: the strengthening of primary care and improved management of chronic disease, the creation of hospital groups and community healthcare organisations, implementing Healthy Ireland, the introduction of more efficient payment systems such as activity-based funding, the introduction of a wide-ranging package of patient safety reforms, a very important agenda, strengthening our ICT capacity within our health service, and the maintenance of a vibrant and sustainable health insurance market. Work is progressing on these various reforms. As well as representing major building blocks for universal healthcare, they comprise important initiatives in their own right, with the potential to drive performance improvement and deliver significant benefits in terms of timely access to high-quality care. In striving for the optimal single-tier health service for Ireland, there are inevitable policy trade-offs to be confronted. These trade-offs often involve tensions between efficiency and equity, or between comprehensiveness and cost control. In all countries, not only Ireland, the trade-offs centre on three basic dimensions of the health service, which must be confronted when designing a health service. These are the proportion of the population to be covered, the range of services to be covered, and the proportion of the total cost to be met. Through the committee, I hope we will be able to more clearly define our ambitions for universal healthcare and the means by which it can be achieved. One of the most important features of any country's health service is how it's funded, both in terms of the amount of money required and the manner in which it's financed. These are difficult questions to answer and will clearly be central to the deliberations of the committee. Making changes to funding levels and financing methods takes time and requires careful management, not least to avoid disruption to vital existing services. That is one reason why it is important to take that long-term view, that 10-year plan of how the health service can be developed. I am not making major structural reforms in this area while the committee does its work, as we have to be serious about building consensus on how to fund a shared vision of universal healthcare. As a new minister, my first step was to put the health service on a sustainable financial footing through an additional €500 million in funding. I have also met with the HSE and all hospital group CEOs and CHOs to stress I want to see results for patients and I want to see management controls to stay within budget. This additional funding allowed new commitments to be delivered, an additional €40 million for home help services, an additional €31 million for people with disabilities, restoration of the ring-fenced mental health budget, and funding for the recently launched winter initiative to address emergency department overcrowding. While the committee deliberates on some long-term issues, life goes on and so does the health service. We obviously have pressing challenges we must continue to work towards. My focus is on delivering practical, achievable improvements for patients and meeting key programme for government commitments. Ministers McGrath, Corcoran-Kennedy, Byrne and McEntee and I have been putting in place a number of initiatives designed to create further improvements for our people. I was glad to be able to launch an initial, stressing initial, waiting list action plan this year and to begin the reactivation of the NTPF with the Endoscopy Initiative 2016 to treat an additional 3,000 people and bring down waiting lists and times in this area. I've confirmed plans to deliver over 10,000 medical cards for children with disabilities whose parents are in receipt of domiciliary care allowance. The HSE has published details of the Winter Initiative 2016 to 2017, which will increase the availability of community care, facilitate timely discharge from hospital and increase hospital capacity using that integrated care approach. I'm especially pleased that we can do something under this plan to reduce waiting lists for orthopaedic, spinal and scoliosis patients. Minister McGrath is establishing the task force on personalised budgets to empower people with disabilities to live independent lives. We've got to move away from this unaccountable, block-granting way of delivering our disability services. Minister McEntee has established the National Task Force on Youth Mental Health to improve the mental health and well-being of children and young people in Ireland. And crucially, the National Patient Safety Office will be established in my department this year. We are also cooperating and coordinating with other departments to deliver key health commitments. A recent example is the Health Innovation Hub Ireland, which I launched earlier this week in Cork, the first national innovation hub in the area of health in this country. It's a key element of our Action Plan for Jobs 2016 and the programme for government, as well as being good for our health services. The Action Plan on Housing and Homelessness includes additional healthcare support services for homeless people, enhanced in-reach primary care services and additional funding to support the voluntary and community sector, making sure we're putting in place those wraparound services that a homeless person needs when they are housed. Minister Byrne has launched a public consultation on the new National Drug Strategy, and that new strategy will be published and will be action-based in January. Last week, Minister Corcoran-Kennedy and I launched a Healthy Weight for Ireland Obesity Policy and Action Plan 2016 to 2025, which announced the intention to establish a Healthy Ireland Fund to allow for further joined-up working between government departments. Obesity is a ticking time bomb in terms of the health and well-being of our people. There is so much more to do. However, these are important improvements already underway on which we can build and indeed we must build. Establishing the Committee on the Future of Healthcare was one of the first programme for government commitments to be actioned, as well as one of the first motions before this House. And I'm very grateful to all on all sides of this House who worked with me and who I worked with them in relation to arriving at this point where the committee was established without delay. It is important too that the process doesn't just create another report to go on the shelf, to echo the words of Deputy Shortall, but does actually lead to something tangible that we can all get behind, regardless of future governments or future election outcomes. Universal healthcare is not just something to implement, but it is a direction and it is a journey. Ultimately, how far and how fast we proceed in the direction of universal healthcare is a question of choices and how we make them. In this regard, I look forward to the Committee's findings and recommendations and the evidence on which these are based. The work of the Committee will mean that members of the public, patients and those working in the health service can have a sense of certainty that there is a long-term strategy and vision agreed by political consensus and, I hope, societal consensus about our direction of travel for a universal health service that will not change no matter what the makeup of the next Dáil. This is, I believe, an essential element that has been missing in reform efforts up to now, and I look forward to working with people on this. We now have an unprecedented opportunity to achieve something that has never been achieved before in Irish health policy, namely a long-term political consensus on fundamental guiding principles. As a country, when we've put our mind to it, we have achieved great things in terms of peace processes, in terms of meeting economic challenges through the decades. We now need to decide collectively to work together to achieve that consensus and to meet that challenge in relation to health. As Minister, I will do my very best to work with you all to make that consensus real. Thank you.
Thank you very much, Minister. Deputy Dr. Michael Harty, you have